Chair, we've received apologies from Councillor Yvonne Jardine.
Okay. Thank you. And it's nice to see some members who we haven't seen for a while here as well, so that's good. So that's fine. I'm pleased to see you. Item 2 is disclosure of personal and prejudicial interests. If anybody has anything they want to declare, now's your opportunity. Nope. So that's fine. We move on to item 3, which is the prohibition of whip votes and declaration of party whips, which is a standard thing on the agenda. And nothing ever gets said, so we'll move on unless anybody's got anything they desperately want to say. And item 4 is the minutes of the previous meeting. Now, everybody will have had a copy of those minutes together with the letters and the response that we've had from Louise as a result of those letters. So if anybody's got anything they want to say that they're not happy with or would like to raise in terms of those, now's your chance. Okay, so in that case, I have a proposal, minutes be accepted, please. Thank you, Sandra, and I'll have a seconder as well while we're at it. Thank you, Wendy. All those in favour, notionally, just to go through do it properly. If you can put your hands up one way or another, that would be useful. Yeah, just like that. Okay. Thank you very much. Item 5 is public question time. I don't think we've had any questions, Liz. No. So that takes us straight to item 6, which is a presentation update on CAMS, Child and Adolescent Mental Health Service. I have to read it. I have to look at it to read it out because I can never remember what it actually stands for. So you'll have to apologize. I have to apologise for that. Having said that, obviously, I don't think Michelle is here. I'm not sure who's presented instead. Where are you presenting instead?
Yeah, hi, I'm Claire Norman. I'm the lead nurse for CAMS.
Okay, so at this point in time, I will hand over to you, and the microphone is yours. The floor is yours on the microphone.
Thank you. I'll just share. If people could tell me, can they see the presentation, please?
Yes, we can.
Oh, thank you. So I'm Claire Norman. I'm the lead nurse for CAMS. Michelle sends her apology. And this is in relation to sort of the current progress, I suppose, of the CAMS service over the last year. So Swansea Bay brought CAMS back into the Health Board's footprint in April last year. However, although we returned to Swansea Bay University Health Board, in terms of our service delivery, it didn't impact in terms of what we offered. So we're still based out of Newport Talbot Children's Centre and Team Merville in the Kingsway. However, we have also looked at providing more focused attempt to work within the community. So what we were mindful of is sometimes you can have young people who may really struggle to get into a clinic, and so therefore they not been able to access a service. So by being able to be more proactive and going out to the young people and the families within their home, we then able to sort of engage a population of young people that may struggle to do so. So there has been more of a focused attempt of that in the last year. The current position in relation to CAMS referral is we've sort of across Wales, we've seen increase in referrals to Welsh CMHTs for children's services by about 39%. Between 2019 and 2022, referrals to Swansea Bay CAMS increased by about 23% for 11 to 18-year-olds. And we broke it down because we've also got a school in reach provision, which was focusing on primary schools for a lot longer. And so we were trying to look at the effectiveness of that service, which is looking at sort of if we can get in there earlier and we can make a difference, does that then impact the longer term sort of outcomes for children and young people? And what we found so far is between 2019 and 2022, we've seen a reduction in referrals of about 17% for children and young people aged 10 and under. So not only is that sort of going against the trend of increased referrals, but it's sort of demonstrating that hopefully that's showing that onwards approval as well. So what CAMS actually provides is services of support and work alongside non-mental health professionals in supporting young people up to the age of 18. And that is young people who may have a mental health disorder or are at risk of developing a mental health disorder. And that can be areas such as mood, anxiety, eating disorders, or where there's potential psychosis. We work in partnership with the early intervention and psychosis team. We have had a bit of a reorganisation in terms of the service, because what we were, and you may be aware of it from previous, there used to be 2 referral routes, so it could be that there was an unfairness in terms of that waiting time. So by bringing all young people together, be it whether they want what we call a part 1 or a part 2 intervention, which I'll explain later on, that makes it much fairer in terms of young people accessing the same services with the same waiting time, irrespective of where they live. So they could live down in the Gower, down in St Thomas, or in Newport Talbot, and they would have the same length of wait, which is based on clinical need and then on first come, first serve. So how what we are governed by are Welsh Government targets, which are focused on 3 areas. So part 1A is that access to an appointment within 28 days. So we are expected to once we get a referral, assess that young person within that time frame. We had a significant waiting list and have done over the past 2 years. So we've had some targeted work over that time frame to try and bring that down. That's focused on the use of agency staff. So we've over recruited into agency positions, and that has been extended until March this year to ensure that we could provide that additional support in terms of the additional capacity needed for the wait. We've also been far more targeted in terms of making sure that we're recruiting into vacant posts. And reviewed nursing job plans to ensure that that's been utilised effectively. Where that's let us stand was in November just gone, which is the most up-to-date figures that we have. We were 86% compliance in achieving that. I can see a question from Mark.
Thanks, Claire. Regarding the previous slide, is there a correlation in the increase in referrals amongst certain age groups? Is that linked to the school absence, do you think, during the pandemic?
It's hard to judge. Sorry, it's hard to judge, but I would be very surprised if it wasn't, because if you talk to schools now, they're all saying they've got onwards difficulties in children accessing school, getting the support. We saw a decrease in referrals when COVID was on, and I don't have the evidence for that. I just I know from working in the service at the time. But what we found is when the sort of pandemic dropped off a little bit and services were being accessed again, we were seeing young people, but they were much more unwell. So sort of my sense is that what you're seeing is at that time more unwell children coming through as well, because they hadn't access to support at the time that they needed them. And of course that's got longer term implications and how long it'll take you to treat them, which is the right service for them to access. Potentially with the right guidance and signposting, they may not have needed CAMS in the past. So there's a whole sort of combination of factors that may then have impacted on that. But I think evidence is also showing that there is a deterioration in young people's mental health across the UK, really. So I suspect I don't know, but I suspect it may have happened anyway, but it's worse potentially.
Right, okay, thanks, Claire.
No problem.
Before you go on, Claire, can I come in and ask a question as well, please, in terms of the referrals? Looking at the graph, it would appear now that the graph is beginning to drop off from the peak that it was there. Are we anticipating that this is likely to continue?
Our aim is to sort of stay on top of our waiting list to be meeting the 28-day target. What I will say is we're in the middle of going through our workforce model, so there may be some ups and downs in terms of hitting the 28 days, but we're far more targeted in terms of hitting the validation and making sure that we're picking up on things and just recruiting into posts. So I wouldn't want to stand here and say, yeah, absolutely, we're not going to reach the 28-day target, because I don't think I could honestly say that. But I don't expect us to be in the position that we were in 18 months ago, if that answers your question.
Yeah, sorry, just for everybody to be clear, I was referring not to the graph that's on the screen now, but the one before that.
Oh, sorry. This one.
Yes. The referrals, there seems to be a reduction coming through there quietly now on the right-hand side. That's what I was asking, whether you anticipate that
sorry.
that is going to continue.
That's okay. We are hopeful that with the early intervention model that we're putting in for the utilisation of our school in reach model, working in partnership with the other agencies, that we can get a consistency. We're also bringing in other pilots in terms of supporting that early access as well. So hopefully that would mean that we were at the consistency of where we want, and I don't expect there to be a big peak again.
Okay, thanks, Claire. I see, Mike, you've got your hand up. Would you like to come in with a question?
Yes, thanks. Thanks, Claire. In terms of the referrals, what are the routes for referral? Who can refer? And have you seen any discernible change in the proportions? You know, have there been more coming through from schools, for example, or self-referrals or GPs, or is it remaining fairly constant?
It's remained fairly constant because we've had quite there hasn't been significant changes in terms of our referral access routes. So at present, referral into CAMHS is via GP referral, education psychology, social workers, health professionals. So it's a professional route. So that's meant that hasn't changed over the years. In November, we did then link in with school-based counsellors, and we've now extended it so that school-based counsellors can refer in as well, because it seems pointless really that you'd have a young person who would be well known to the school-based counselling service. They are saying we think you need CAMHS, but they couldn't come directly to us. They would have to go to the GP, who, let's be honest, is going to copy the letter, put it in a referral and send it on to us anyway. So we've worked with the school-based counselling service, and we've got a pilot for a year, but I envisage that will continue moving forward. I think it makes sense to carry that on. So that's extending it that route. School-based, for the school in reach service, there can be a referral route in that way, and that's because with the school in reach team are attached to CAMHS, so we've got CAMHS nurses working in that service. So although they're not an official referral route, if they see a young person and they think, oh, actually you need CAMHS service, that young person, when they've seen at that moment, that assessment happens there and then, providing the parents' consent. So what we're trying to do in that sense is minimise that bouncing between services, because it's ridiculous that we've got a CAMHS staff member who's saying, I think you need CAMHS, and I can do the assessment, but because I'm in this team, I'm going to refer you in, and then they are going to do the assessment. And that's part of the work that we've done in terms of trying to manage the waiting list. But the numbers aren't too bad in that. We had a bit of a spike in them at the start of the new academic year, and they seem to have gone down. And I think that comes from the practitioners identifying the right people, really, rather than just everyone and everyone. Does that make sense?
Yeah, thank you.
No problem. Is there anyone else before I move on? Okay. So I was on here, wasn't I? Sorry. So yeah, so compliance in terms of Part 1A was 86% in November. And as I said, we're actively working on that to sort of maintain that and to keep that, really, because that's what we want. It means people get effective treatment as quickly as possible. The other component that we sort of then try to meet is what we call Part 1B, and what that is that following the assessment, that young person is then offered the intervention with the clinician who's going to provide the treatment moving forward. And again, that needs to take place within 28 days as well. So again, we've had a lot of work in that. We weren't sort of, when we came over in April, we weren't meeting that target, but there's been sort of an organisation in terms of looking at the staffing levels, the use of the agency staffing again, psychology have restructured so that there's more structure within the psychology team within CAMHS, and the revalidation that's taken place has meant, again, that supported that. Again, in November, we were 100% in terms of hitting that target. It has dropped slightly, but we were expecting that in terms of normal achievements, I suppose, but also there's been some validation work that's needed to take place, and that's also identified some young people who were outside of that period that we needed to pick up.
Basically, obviously, I think the graphs for part 1A and 1B are showing the improvement that we'd like to see. What I don't really understand is how those trajectories are developed, because they don't seem to make sense compared with the individual figures. I don't know if we've got any explanation for that. For example, if the one you got on the screen at the moment there, which shows the interventions within 28 days, is a very big increase on the right-hand side, but the trajectory stays basically the same.
Yeah, and that came from when we came over to the Health Board. There was a very conservative sort of perspective taken on terms of that trajectory. So there was a sense of we needed to get a footing as to where we were and to understand where we were. So in linking in with the NHS executive and what have you, that and sort of the management structure, it was agreed that a conservative approach in terms of that trajectory would take place. However, we were able to then sort of really get into our validation systems in making sure that we were able to process young people and understand where they were at and who was there. And that alongside, we weren't, when we had the agreement, I think it was in September, to continue with the extension of our agency staff until March, meant that we had a far more stable workforce moving forward as well. So then again, that helped us, because with the nature of the 28-day part 1B, you've got to be very mindful of who's picking that young person up, because they've got to be there to follow the course of treatment through. So if you were in July saying, right, we're going to let our agency staff go in September, for example, we couldn't give them any 1B work because that wouldn't be fair on the young person, because there wouldn't be that consistency. So in the September, we were then able to sort of say, well, in the June or July, actually, we were able to say that the extension to September was being extended till March. It gave that consistency in terms of being able to pass the young people on to the people who could do the work, if that makes sense.
Yes, I think so. Thank you.
No problem.
Sorry, Sandra.
Hi, can I just make an observation about that part 1A graph? Whilst I do acknowledge the improvement in the general trend of the curve, it does concern me that the axis starts at 100. So it is a little misleading if you look at the left-hand axis. As at September 20, well, certainly August 23, there were probably about 130, I think, children. September 23 was probably about 120, and either no detail for October 23, or good news is it's dipped below the 100. And it might be helpful if the axes were the same, so that we could see the true trajectories, if that's okay. Whereas compared with 1B, the axes does start at 0, and we can see the trends that are happening there quite clearly.
Yeah, no, I get what you're saying. In October, off the top, this is off the top of my head, I believe it was under 100, which is probably why you can't really see it. But and so yeah, I do get that point about the axes. Roughly, I believe we're sitting at about 100 at the moment, so that would be the data. It's not 100% confirmed because I don't have it in front of me, but I believe it's around about 100 at the moment. So we are sort of sitting around that. But yeah, I'll certainly take the point forward in terms of the axes, making sure that they're accurate moving forward.
Thank you.
Anything else before I move on?
No, the floor is yours again, Claire.
Thank you. The final target is in relation to part 2, which is what we call our care coordination, or CTPs. So that's young people who have got far more entrenched mental health disorders and need a care coordinator and ongoing support. Within CAMS at the moment, there are probably around 60 to 70 young people at one time receiving that, and that's consistent with the All Wales position for that. Now, young people access this service. they've either been identified via referral route as needing that straight away. Maybe it's a referral in from a different health board where the young person may be on a care and treatment plan, for example, or it may be that they're having a piece of work in terms of our 1A service, for example, and it's identified that the need is a bit more entrenched and this additional support is required. They then access that for a weekly clinical review, which is a multidisciplinary, which consists of our consultant psychiatrist, our psychology colleges and nursing staff. This allows us to review exactly what's going on and wherever care coordination is needed for them. At the moment, we're not doing too bad. We stay consistently within the targets that's needed. It varies between around 90 to 100 roughly. And there has been 2 nursing vacancies out to advert within that team at present. In addition to that, there's been some ongoing support around an emotional health and wellbeing delivery plan. So this has been developed in conjunction with the West Glamorgan Regional Partnership Board. It's been a 3-year plan, which has, although it's been developed, it is waiting on sign-off from the RPB Children and Young People Programme Board. The aim is to promote partnership working and to improve the multi-agency working, really. And then that's used to deliver the strategic aims of improving access to emotional health and wellbeing support and develop a better range of services for children with emotional health and wellbeing difficulties. So it really is that focus on that early intervention work. In addition, there's been the development of the NEAF Nest framework, which is again sort of been identified by Welsh Government, and it's a planning tool which looks at the whole systems approach for children and young people. There are a number of categories within that, such as a safe and trusted adult, people working alongside each other, and so it's about really looking at that system behind the child. There's a multi-agency implementation plan which was developed and being led by the Regional Partnership Board, and there was an annual review submitted to Welsh Government in October. There's also an implementation tool launch to be held on the 28th of February, as it's taken forward there. There's also additional support being put in place in terms of services such as Tidy Minds. They've now got a coordinator in place who's working a couple of days a week. So they're going to be able to sort of develop it further, make sure the information's up to date, and just sort of make it as meaningful, useful tool for the children and the families within and the professionals within this locality as possible, really. In addition, Swansea Bay Health Board have been funding the COOF platform, which is an online wellbeing and mental health community really for children and young people, which also provides support and counselling if required. It's been funded since COVID by CAMS. However, the funding from COVID stops of this year, and it's been reviewed in the Regional Partnership Board in the coming months to identify if as a region it's something that wishes to be continued and to taken forward, and that's going to be identified by a presentation as well that COOF are going to be providing to sort of the partner agencies as to support that decision being made. And then finally, there's now an age-blind emotional health and wellbeing strategy being developed. There has been a number of engagement sessions to promote it. However, it was felt that the children and young people could be further supported. So that's why additional sessions have been added so that CYP perspective could be further enhanced. The aim then following that is to develop the implementation plan of that moving forward. Okay. And then that's all in terms of the presentation. So I don't know if there's anything else. I can see a question from Mike.
Sorry, we've got a question coming in certainly from Mary. So would you like to ask the question first of all, Mary?
Well, first of all, thank you, Chair, for allowing me to take part. Claire, I'm not part of this panel, but I did the original CAM scrutiny. I chaired it, and the chair himself, Councillor Hood-Williams, was with me on that panel. And this is a different service to what we had when we started out. It was appalling. We had parents and young people coming to our meeting, and we went out into the community and they were begging for help, and it was years, not months, that they were getting the help. Some of the children had gone from primary to secondary school. So congratulations on all that work. I know it works. I've heard, very good things about it. And I'm glad to hear that there are referrals now through education professionals, because yes, people had to go to their GP, which, you have to get an appointment, which is very difficult sometimes. The one comment I've had, which is a negative, which you actually mentioned yourself at the start, is accessing the actual service when you've been allotted to CAMHS. The one on the Kingsway in Swansea, it's parking. It's very difficult and it's expensive if people... There's no parking now in these surface car parks by Marks and Spencer's and Park Street. To go to the multi-storey, it's still quite a walk. And also, if children are coming on their own, or young people, I should say, the bus station is a long way from where the service is. But they all agree the service is fantastic. And thank you very much for everything you've done. And let's hope, and we don't have too many dips, but obviously with a needs-based service, it will happen. But it's so different, I can't believe. So I haven't really got a question. It's just really, thank you very much for everything that's been done.
That's really appreciated, and I think there have been circumstances where people don't have to go to Team Able. If for example, if they want to, they can go to Neath. So if parking is an issue, it's not you live in Swansea, so you have to go to Swansea. There has been circumstances, and I'm without sharing, where the needs of the family meant that there was a very long bus ride. They were disabled, and that we were like, why are we doing this? We're going to come to you. And my strong aim is that actually we get in and we do more work in the schools as well, because actually that's where, if we can understand that it's the community for the child, the parents can access it easier. Now, I'm not saying there's going to be a massive change in that, but that's certainly, we've got to be far more proactive and working alongside our partner agencies. And one of the things, and hopefully some of you might want to come along, is on the 9th of February, we're having a children's mental health event, which is bringing all the services for children together, for people to come and see what's available so that they know. And that's in the waterfront in Swansea. So hopefully there is a different service, and that instead of looking down and trying to be inside, we're trying to look out more and work in partnership. And hopefully that will continue as we move forward.
Thank you for that. And yes, I think I'd like the details, as I'm sure other councillors would, of that event, so that, well, any councillor could perhaps come along.
Yeah, anyone. I'll forward it to, there's someone who sent me an email, so I'll forward to that individual if it's okay for that to be shared.
Okay, Claire, thank you very much. I can't see any other hands at the moment. And certainly as far as what Councillor Mary Jones has just said, certainly we have seen a massive increase in improvement, improvement in what's going on within CAMHS. Obviously, we want to hopefully see it continue. So we'll ask you to come back every so often on that basis. Thank you very much.
Thank you. Take care, everyone. Bye.
Bye. I'll move on to item 7, which is a corporate parenting board update. Are you going to take us through this, Louise?
Yes, please. Thank you, Chair. Yeah, so it's really been excellent having the opportunity to chair the corporate parenting board again this year and over the last year. And I really want to thank all the board members in particular, so all the council, child and family service councillors, child and family service officers from across the council and the other organisations that link in. Wanted to thank Gareth Borsden from Democratic Services for the support over the year. I will say it would be good to have some more regular and consistent attendance from some partners. Won't mention any names, but we've had a presentation from one of them just now, but which is frustrating, because it would be good to have that sort of cross-service approach to how we look at corporate parenting. The board, I think, is a crucial body where we can take time to drill down into our key responsibilities as a corporate parent, and crucially, ensure that the children and young people for whom we've got caring responsibilities have the best lives that they can have. At the time of writing the report, there were 479 looked after children and 487 care leavers. Of course, the panel gets the regular updates on this. The Welsh Government, as it outlines in the report, the Welsh Government has recently sort of refreshed its look at corporate parenting boards and launched its charter last September. And I'm really pleased to say that we were one of the first to sign up to this. And the 11 principles in that charter very much echo our pledges, our corporate parenting pledges, which we've developed, which fits really nicely. So we've done a lot of work over the last year finalising our corporate parenting pledges, and it's going to full council on Thursday. So it'd be great to have that there with some of the young people going to speak on it and present on our behalf. This is a huge piece of work, so a big thank you to Josh, who's led it over the last year, more than a year. Well, I can't remember how long you've been doing it now. Yeah. You know, to really synthesize everything that we do and everything that the young people's, it was their voices. They led this piece of work. They work one-to-one with members of the board online through the pandemic, and then with Josh to kind of really bring this into 7 short, sharp things that they want us to work on. So that's there on in 2.3. What they've come up with is that we should have no barriers to opportunity, good education and a good job, healthy relationships, a safe place to live, mental health, as we've just talked about, love, family and friendship, and happiness. So I don't think there's anything where anyone could disagree with that. But then the next steps is how do we actually deliver that? How do we sort of turn that into some meaningful things, actions across the council and partners? Building on this, the young people wanted to share their thoughts in a series of podcasts, which have now been officially launched. Josh organised a fantastic event in the Dylan Thomas Centre. Was it last week? How confused. Everything's sort of merging into one, which was brilliant. And I think they're going to be put on the council website at some point. So I'm sure we'll share the links to that. And they're so impressive. We heard some clips of those at the corporate parenting boards as well. And there's nothing better than hearing it from the horse's mouth, really, and hearing children and young people, their own lived experience and what they want us to do as a council. So these conversations then have very much shaped the work of services. There's a long list there in 2.6.2. Sorry, scroll on. Yeah, of all the things that kind of come as a result of some of this work, and particularly sort of important is that we've signed up to the Charter for Care Experience Parents. That work was done was it with Cardiff University? Yeah, which we've signed up to. So that's a really good milestone that we've worked on there. And then, as you can see from the work plan in the appendix at the end, we've had packed agendas in our quarterly meetings, lots of updates on really important issues. Some of these have come to the panel as well, so you'll be well aware of a lot of the work there. So yeah, just a quick summary there of what we've done this year in corporate parenting, and a big thank you again to Josh and Louise for preparing the report, and to Dave and Julie for their support over the year.
Thank you, Louise. I'll now open this to anybody who wants to ask any questions of Louise. Oh, the mic is on, isn't it? I had got my mic on that time. Sorry? Oh, Mike, sorry, you got your hand. Can't come up on my screen, sorry. Mike?
Too many mics around. Yeah, thanks, Louise. Obviously, you know, it's critically important, isn't it, that this particular activity and responsibility is demonstrated and shared. And I think that from our point of view, you know, as councillors, you know, we should be there to back it as much as we can. I wanted to just ask, though, about the numbers and so on. If I could just refer you to paragraph 1.4, which you mentioned yourself about 479 looked after children. I don't want to kind of you know, be I don't know, sort of too pernickety, but I couldn't make the numbers add up, the 479 and then the numbers that followed. So I just wondered, are all the numbers referred to in paragraph 1.4? So, you know, living with foster carers, kinship carers, etc., there seemed to be a balance which didn't appear in the 479. So I wondered how many of those also were out of county rather than in county placed. And then I wanted to talk a little bit about the destination of care leavers, but do you want to just comment on that point about the numbers?
I'll bring
first,
Julie in to comment on the numbers if that's okay. I apologize if I haven't added them up. check
No,
them
you're
out.
absolutely right, Councillor, they don't add up. And that's because I only included some of the main categories where children are living.
Okay.
So there are some children that aren't in there in terms of they're living in other types of arrangements. So they are quite a small number. And I can't remember what the categories are, but that's why they don't add up.
Okay. And out of county placements, how many have we got currently?
In terms of outside of I don't know the number off the top of my head. I have to refer to the latest performance report. I can quickly have a look while I'll just go and refer to it in a moment. In terms of I know Scrutiny has a particular interest in children that are living in England, and we do have less than a handful of children living in England at the moment. So we are bringing more children back into Wales and back into Swansea. So if you don't mind, I can find you the number if you give me a couple of moments. I'll just check the latest performance report.
Fine. And without going into details in terms of the numbers, I mean, is the number that we quoted there in terms of November 23, 479, is that number sort of going down, or are we seeing an increase in the number of looked after children?
It's stayed at around about the 480-ish mark for quite a few months now, almost a year, I think. So that's into the rates of looked after children.
Okay. Thank you. If I could move now to the destination of care leavers. Obviously, it's really encouraging to know that there are people who are leaving the system, if I can call it that. But I wondered, are we completely happy that they're going on to something which is supported, which is helpful, and where they perhaps are not left to their own devices?
Yeah, I think we have a presentation in this panel on care. Oh, it was in corporate parenting. Yeah, so perhaps that's something we could bring a more fuller discussion on that. But yeah, we have a care leaver service, and Julie could share a bit more.
Yeah, every care experienced young person up to the age of 21 has an allocated young person's advisor. And up to the age of 18, because some care experienced young people leave care at 16, has a social worker as well. So they'll have a pathway plan in place. And the challenges that we have at the moment for a lot of young people, including care experienced, is having suitable accommodation when they become independent. And I think that's a challenge across all of Swansea for a lot of young people, not just care experienced. And another challenge that we have is availability of appropriate employment opportunities and helping them to gain those. So that we did, perhaps I could bring that detailed report back if the chair would like that. But we did have a helpful presentation on this at Corporate Parenting Board recently that explained the remit. So the basic income pilot, for example, was something that was there to help young people have a care experienced people have a good 2 or 3 years in relation to additional income that would help them get on a more positive pathway. But I think it's fair to say, and this is the point of the work that particularly Josh is leading on, there's always more that we could do better and differently to help care experienced young people. And one of the things that we're particularly championing at the moment, based on the previous presentation, is recognising care experienced young people as needing quicker access to CAMS services. Because their need is there's probably proportionately more of them that would need that support, and the trauma that they have experienced through their life would, we feel, should give them priority access. But yeah, I'm sure there's always more we could do, and certainly young people are telling us that in relation to living their best lives.
Thank you.
Okay. Obviously, one of the things that we've always looked for in terms of the corporate parenting board is the outcomes that children are achieving. I mean, obviously education is important as far as we've been concerned in the past, but you know that as well as I do. When are we likely to see those reports coming forward?
I think we've got the virtual school now, for example, which is a good way of, it's like a portal, really, isn't it, of tracking how our young people are achieving educationally and progress they're making. But obviously, it's not just all about grades necessarily, isn't it? It's about, you know, making progress and about having you know, what matters to those young people. I don't know if we've got any statistics and things, or was that what you were suggesting?
Well, I know a couple of years ago we were very concerned about the disparity between the outcomes at year 6 in the schools compared with year 11.
Right.
And we were asking and looking for an explanation, which we never really got out of it, I don't think. But that's something that we need to be keeping an eye on, just to see whether there is that deterioration going on year on year on year, and if so, why.
I don't think we've returned to the pre-COVID position. Education colleagues would say of actually tracking, of recording and tracking that data, because of the data tracking system that education have to provide Welsh Government. That bit hasn't been reinstated from what I understand, but it's certainly something that we ask in Corporate Parenting Board in relation to opportunities and access to learning and education. And most importantly, being in education for care experienced young people and those that leave care. So we've got, through our Needs Prevention Partnership in particular, focusing on those more vulnerable young people in relation to accessing further education and learning and employment opportunities. But I'm pretty certain, and that was one of the reasons why we're very hopeful about the virtual school model. It will start to give us that data again that we haven't really had, but it is about progression, not just about the grades that they might achieve in the subjects that they've chosen to take.
So are we likely to be in a position reasonably soon where we can have a presentation in that respect?
I'll check with education colleagues in relation to implementation of that. It's still being piloted across Wales, but we are part of that pilot, and they're supporting each other to learn how best to implement that model.
Even if we can't get it into this municipal year, perhaps we could look at it certainly for next municipal year.
I'm probably more hopeful for them, I think.
Okay. Anybody else got any questions? Very quiet. You're getting away with it lightly. Don't smile there too much. You never know.
Such a
It might come and bite you.
with everything
Got
in
it?
it.
Anyway, sorry, Erica.
Right, thank you, Chair. It's an observation really, Chair, of I think how far we've come and the changes we've made, because as Mary said earlier, we were around when CAMS was not working, and that's moved. With corporate parenting, seeing what Josh and Louise are doing with our young people, I think is amazing, because we are listening. We can't do it, but we ask you to do it, and they're doing it really well. I was pleased to go to the event that they organised with Looked After Children and hearing their views. And one thing that stuck to me is that they don't want to be treated any differently. They just want to be seen as everybody else. And I can't use the word normal because I just don't know what that means anymore. But it's really just to say big thank you. We're definitely going the right way. I know we don't touch all the people we need to, but I think when we've got people who care, working with people, with youngsters who are our future and who really matter, I think we're on the right tracks. It's just an observation and to say thank you.
I think I was saying in the last meeting, certainly if not the last one before, how the department has moved forward, certainly since the days when we were in intervention board or what have you. And that's a pleasure to see. Just keep up the good work is what you've got to do. And that's what's important. But we will ask the questions if we think we need to, hopefully. Yeah. Anyway, thank you very much for your presentation. Thank you for that, Louise and Julie. So on that basis, unless anybody's got any other questions, I'll move on to the next item on the agenda, which is the work plan. And I suppose most importantly now, coming up very shortly, we will have a look at the budgets and see how that's going to pan out. Can't see David frowning too much, so he's obviously comparatively happy with the budget he's going to get by the sound of things. Okay. In that case, unless anybody's got any other further questions, any comments? Oh, sorry, Mike.
Paxton, yeah, sorry, Paxton, just to ask, just following
sorry,
up.
Sorry, Mike, you're frozen on the screen and we're not seeing your hand at all. And your face isn't moving. It's solid. Sorry, that's why we're not picking you up. Sorry.
Is it okay now? Can you hear me okay?
Yes, yeah, that's fine. We can hear you.
Okay, thank you. It's best to hear me, not see me, I think, probably. But anyway, just following up the conversation from the last item, is there room within the work programme for us to receive that report that Julie was talking about looked after children?
I'm sure we can. I'm sure we can fit it in over the next few months. Yeah.
Is the one specifically about
Not
care
quite sure.
experience?
Pardon?
Was this one specifically about destinations of care experienced and that?
Yes.
That one. Yeah, I think I was looking at the work plan and we've got an update on the basic income. I'm sure we could probably weave something into that.
And we've also got a report on education
Education
attainment
attainment
as well
as well.
next time. So yeah.
So yes, is the short answer.
Thank you.
So simple
What was
answer,
that?
I think, to that.
Oh no, actually, I'm looking at corporate parenting.
Simple
board.
answer, Mike, is yes. Yeah. I wish I could
Yes.
see some response from you. I don't know whether we get it through or not.
Yes, thanks. Can you hear me okay?
Put
Okay.
it in.
Nothing else, I don't think, is there? On that basis, if I may, and if anybody's not got any other comments, I'll bring the meeting to the close. Say thank you to everybody. Thank you to everybody for their attendance and for the questions that have been asked. And look forward to seeing you at the next meeting. Thank you.
Thank you. Bye.